We have with us Dr. Sumedha Sircar, who's an MBBS graduate from KMC Manipal, and she has worked on the front lines during the COVID pandemic in India's rural regions. She then went on to finish her master's in health management from Harvard, and she is now the South Asian head of a femtech enterprise. She's also written for various publications about public health and health, and today she is here to speak with us about cervical cancer. Hi, Dr. Sumedha. Thank you so much for being with us and welcome to the discussion.
Hi, thank you so much for having me. It's a pleasure to be here.
Of course. So I've given a brief introduction about yourself, about you. Would you please tell us some more about yourself and your background?
Absolutely. I went into medicine because I loved science and I also loved stories and people. And medicine is about the science, but it's also about you can only practice medicine if you feel the pulse of the community you're serving. And boy, did I get to hear some great stories. So I became a doctor the month COVID became a pandemic, which I try not to take too personally. But anyway, at a very young age, like literally from day one, I got exposed to really, I had to deal with the health systems of India in a very like profound way and in a way that I was not prepared to, at all. So I got very interested in the public health aspects of things because it seemed to me like inefficient management of resources were a key rate limiting factor in healthcare delivery in India. The science is there, but who finances deployment of the science and who figures out where the resources are allocated? So I did my master's, very lucky to do it from Harvard and MIT, and met some wonderful people there. Got really interested in and was just fascinated by the technology I was seeing in Kendall Square in Boston and in Cambridge. So I think, and me bringing this technology, cervical cancer screening and treating technology into India is just, playing with technology and bringing it where it's required, which I think has been my dream since 2020.
That's really nice to know. And of course, you have experience working with rural areas as well. So I'm sure you have thoughts about, cervical cancer awareness in general in India and especially in the rural regions. Can you tell us a little bit about that?
Absolutely. It's a nightmare. Like I can't even believe what I was seeing. So the reason I was in rural, so I got a government scholarship to go to med school, and the condition was that, hey, you have to serve for a year in rural India, in rural Karnataka to be specific. And I saw women who were told because they had something down there, 20, 25-year-old women, they were given hysterectomies. Like these young girls who were literally younger than I am, were put into instant overnight menopause because their doctor didn't know that cervical cancer in the precancerous stages is highly treatable with a 30-second procedure. And they went on to, rob that woman of the ability to ever have children and deteriorate her life significantly. So what I see even among the medical professionals is a fear of cancer, of cervical cancer that doesn't need to be feared in 2024 because we have the technology to treat it. I see a complete lack of awareness, a complete inability of healthcare professionals to communicate to patients why screening is important, why the vaccination is important. So yeah, that's what I saw.
That's crazy that to treat something in the cervix, there are hysterectomies that are being performed. We will put up a diagram of the reproductive system, but could you walk us through cervical cancer? Where does it affect and how is it caused?
Sure. So almost all of cervical cancer is caused by something called the human papilloma virus. And there are several strains of it, but about 90% of cervical cancer is caused by two strains, HPV 16 and 18. And all the vaccines that are available in the market now, they do offer protection against both these strains, among others. So when one gets infected, there's the great thing, I would say genuinely the great thing and the opportunity of cervical cancer is that the precancerous phase is several years long. So you have the uterus and the cervix is the base of the uterus, right? So what happens is that over a long period, a precancerous lesion appears. And then when it's not treated, because in rural India, and in fact in urban India, women don't take their health seriously. Like if they're having discharge, pain after sexual intercourse, or if they're, which is called dyspareunia, if they have, even bleeding or things like, they just ignore it. And then after that, it invades into the surrounding organs, the parametrium, the bladder. And in fact, Sandhya, about 60% of cervical cancer cases diagnosed in India are diagnosed at a locally advanced stage, where at which point you need serious surgery, you need radiation. India does not have infrastructure to deal with hundreds of thousands, lakhs and lakhs of women coming in with, advanced cervical
Yeah.
cancer. And the
Yeah.
fact that it has such a long precancerous stage where you can literally zap it, like just zap it, and
Right.
it's not getting done in 60% of the cases, it's an abomination.
And women are still going through discomfort through that whole phase. There are
Yeah.
some symptoms, right,
Yes.
of an HPV infection.
Not of an HPV infection, that is
The pre-cancerous lesion, then.
yeah, but
Okay.
when a lesion forms,
Hmm.
that is when, yes, pain after sex, foul smelling discharge, unusual discharge. It could be colored, it could even be colorless. But Sandhya, the point is that cervical cancer can be detected years and years before someone gets to the stage. Actually, no one should be getting to the stage of any symptom. What needs to happen, and what the WHO has called for, is that 70% of women should be screened at least once by age 35 and once more by age 45. And if this routine screening is put into place, which I think the government is trying to do, WHO is trying to do, no one will ever have any symptoms from cervical cancer, because it's going to get detected and it's going to get treated in time.
Right, right. And can you tell us how the screening is done? Like if I walk into a clinic and I want to ask for cervical cancer screening, who should I go to and what will they do?
Right. So there are different aspects to this. You being like an educated person who's aware of about their health will actually go out and seek this, and you're probably going to go to an urban hospital. So something you will undergo something called a pap smear. And your gynecologist will administer that test, and if some abnormal cells are found, you're gonna there's going to be HPV testing, and that is when they're going to figure out if something is if you have the virus, and then the next stage would be biopsy, treatment. All these things sound scary, but it's really not.
Hmm.
It's not a walk in the park, but it's as close to a walk in the park as anything related to cancer can be.
Yeah, exactly. You're not thinking of or talking about like radiation or chemo. You're just testing yourself and like getting rid of it
Yeah.
before you get to the cancer stage.
But Sandhya, like this is overwhelmingly so. I think the fascinating thing about cervical cancer is that it tells you so much about society, because it's overwhelmingly concentrated in rural areas, and the patients who come in are sort of impoverished women who have to avail government services. So what ends up happening is there are a lot of NGOs, hospitals even, that go out and do cervical screening camps, because these women are not necessarily going to be aware that there's something called screening. And in those low resource settings, what ends up happening is something called VIA, visual inspection with acetic acid. So literally just flooding the area with acetic acid, and if it turns what is called aceto white,
Okay.
it's gonna that's when
That's the positive. Okay.
yeah.
Got it, got it. And with respect to cervical cancer, I believe there's still a little bit of stigma about how it's sexually transmitted. But HPV does also transmit in modes other than sexual transmission. Can you just tell us a little bit about just the transmission of HPV?
Absolutely. It's so troubling about the deeply misogynistic and sexist comments that people make. And first of all, think about it. If HPV were really just a sexually transmitted disease, we would also give the vaccine to men, right?
Yeah.
Because men do pass it on to women and back and forth. But we don't, because the honest answer is we don't know enough about HPV transmission. We know it can be sexually transmitted, but there are other ways. Otherwise, it wouldn't be so widely prevalent in the population, right?
Right.
So I would actually say we don't know exactly. We don't know all the ways it can be passed. We certainly know that it's not just sexually transmitted. And even if so, what? Like we need to reposition it is not an vaccine. Just like hepatitis B is not which is also, by the way, sexually transmitted. Hep B is sexually transmitted, but nobody thinks of it as an STD vaccine. And we should think of HPV as just a cancer prevention vaccine, which is what it is.
Right. And it also tends to be latent in the body, as far as I understand. So, as say a 20-year-old, it's possible that I might have contracted an infection through some means, and then I find out only at 40 or 45. That is likely to happen, right? I just want to understand how latent, how long can it be latent in our bloodstreams and in our bodies?
That completely depends. First of all, which strain you've gotten. There are many benign strains which is just going to hang out in your body and not going to disturb anyone, right? Secondly, it depends upon your immunity. For example, did you know that HIV positive women, retro-positive women, are maybe 6-7 times more likely to get cervical cancer, and that is because they're immunocompromised.
Immunity is compromised.
So, I cannot answer your question. It'll take you 2 years or something.
Sure.
It could several years depending on your health and depending on the strain of the, which is why pap smears are so important, which is why, screening is so important.
Right. And HPV vaccine typically is recommended for women of younger ages. So what do older women do? People who have never been vaccinated before, is it still beneficial to vaccinate them? Because the understanding is that by this age, people might have most likely already contracted some form of HPV. So is it still beneficial to get vaccinated after the age of 35, 40, if you haven't had cervical cancer?
So, Sandhya, it's not an age question. It's a sexual activity question. Why do we say 9 to 14? Because girls that age almost certainly would not be sexually active, right? So that's the idea. So if somebody has already been sexually active by the time they're 35, 40, there is certainly no downside to taking the vaccine, but the upside reduces pretty dramatically. So whether or not a 35, 40-year-old woman is taking a vaccine, what needs to happen is, are those regular screenings? Are those,
right. So pap smear definitely, and then vaccine also if possible.
Absolutely. Yeah.
Great. So can you tell us about what your experience has been with dealing with public health in India in general, as compared to, what you've studied there at Harvard, and how the context is in India in terms of public health awareness after COVID?
Honestly, India is such a delightfully complex country where people latch on to their niches and their beliefs. And then India is also very hierarchical in terms of like age. Like I'm 27, right? And a 40-year-old person may not listen to me just because of my age. Or just because of my gender. Those things I think come a little bit more into play in India. It's challenging. I think what doesn't happen as much in India, Sandhya, if you notice, even MOHFW, and correct me if I'm wrong, MOHFW used to publish information about COVID in Hindi and English. So, but the lacuna was the other regional languages, right? So, where is the misinformation getting spread? In Marathi, Bengali, whatever language is native? Because I don't know, I guess the trust is more in the native language, and you're more comfortable with it. So I think that is a big way India is different, is that things need to be really hyper localized and things need to be really hyper personalized to the socio demographics of a person.
Right. And this looks extremely promising now. Cervical cancer awareness I would also primarily credit Poonam Pandey. I know not a lot of people who are fans of what she did, but I have written about cervical cancer, and I'm sure you have also seen the number of campaigns that we've had for awareness. And this was pretty effective. So it was pretty good. I kind of liked it. Is there anything else that you would like to add and let our viewers know about cervical cancer, especially in India?
Yeah, I think cervical cancer, 604,000 women in the world are diagnosed with cervical cancer, of which 342,000 die. And of the 342,000 who die, about 78,000 are in India. And I'm not saying this as I don't want to position as this is somber, this is unacceptable. It is unacceptable, but it also represents a fantastic opportunity for us. Like we are now in the we have the means and the technology to eliminate a cancer, which is a big deal. When in history have we ever, we eliminated infections, and now we're eliminating cancers.
Cancers, yeah.
That is a fascinating progress in human technology and in human abilities. So the political and the public will to eliminate a cancer we should not need Poonam Pandey for that, right?
Yeah.
It's exciting. It's a fantastic opportunity to help women, and it's not just to help women. Like Sandhya, like I've seen the quality of life of women who, at 25, oh, we found something in your cervix, we're going to do a hysterectomy. Or the women who get diagnosed too late, and therefore their quality of life completely goes for a toss. It's not required. No one's quality of life needs to get upended if they get diagnosed in the right stage. And these are young women with children, with families to care for, and with jobs to look forward to. So yeah, I'm excited to see India really partaking in eliminating cervical cancer. 15% of women, not women, girls, about 15 years of age, are getting HPV vaccine. And even this 15% is disproportionately concentrated in high income countries, in
True.
Western countries. In India, the percentage is not just that. Like when I was a final year medical student, I went to take the HPV vaccine, and my professor said, who's a very well-regarded obstetrician gynecologist, said, oh, if you're going to be in a monogamous relationship, why do you need to take the vaccine? And I was just
Oh,
like, can you see the level of
yeah.
stigma that we're dealing with? He's
Yeah.
a doctor. I was going to be a doctor.
Yeah.
And I'm like, who cares about monogamous, non-monogamous? It's about cancer. If you can prevent a cancer, why wouldn't you?
Yeah.
Right?
Yeah. Yeah.
So
That
we
that
have a lot
that
of
is
work to do.
definitely. I suppose my last question would be, in your mind, what is an ideal case scenario for India about 5 to 10 years down the line when it comes to vaccination and cervical cancer?
I think India is very good with vaccination. I mean, just because we've not achieved the rates of HPV vaccination that
Yeah, we've done it with other vaccines
we've
very
done fantastic
meticulously.
work with
Yeah.
polio. The last mile connectivity and the way we've solved supply chain issues, it's remarkable. So I
Yeah.
am optimistic, and I believe the NTAGI has recommended that HPV vaccine be put into the UIP, Universal Immunization Program, which all children are. That's what
Yeah.
they follow. So once that happens, and once HPV really gets positioned as a cancer prevention vaccine, which is what it is, the World Health Organization has called for the elimination of cervical cancer by 2030. So the first, and there are three pillars to this, and without us achieving all three pillars, the roof will fall, the roof on the elimination of cervical cancer. The first is that 90% of girls between 9 to 14 years of age need to get the HPV vaccine. Second is that 70% of women need to get a high quality screening at least once by the age of 35, and at least one more time by the age of 45. And the third pillar is that 90% of women with precancerous lesions or invasive cancer lesions are, need to get the necessary treatment for their condition. So the idea of vaccine is very enticing because and it's very important. India is very good with vaccines, and it's comforting to think that one injection or two injections can just like save you from all this. But over the next 20 years, because there are so many women who have already been exposed to the HPV virus.
That's really nice to know, especially considering you have frontlines experience. I'm really happy to hear that. And thank you so much. This was a very enlightening interview. It was quick and brief, and I hope our viewers who are watching this have all the basic information that they need about cervical cancer and HPV. Thank you so much for joining us today, Dr. Sumedha, and thank you for the wonderful discussion.
Thank you for having me. Have a great day.